Dr. Deidre Mason is a doctor in naturopathic medicine, health director of Elite Health, integrative health director of Elite Health Medical Group, also part of our clinical faculty for nutraMetrix Educational Institute, and director of clinical research and education for nutraMetrix, helping support the education of health professionals and consultants in our nutraMetrix products. Please help me give a nutraMetrix welcome to Dr. Deidre Mason.
You know, I've been given the opportunity to work closely with nutraMetrix, with you, and with our health professionals, and I would say it's made an incredible impact on not just my practice, but kind of the network, or the wellness network that I've been given the opportunity to work with. When I looked at nutraMetrix, I don't know how many of you know this, but naturopaths, we're kind of stuck up. We think we know it all, especially when it comes to ingredients. So when the nutraMetrix line was revealed to me, when I looked at isotonics, I thought I literally spun on my heels, because I was walking away. I was like, we're good, we know what we like here in the practice. My NC mentioned isotonics to me, and I literally spun on my heels, because I now had something that a stuck-up naturopath couldn't be without. It was something that would generate a quality product for my patients, right? Something with no fillers and binders. It did something else that a lot of naturopaths don't think about, and I would say a lot of health professionals don't think about: the business behind medicine. It was also going to give me a competitive edge next to any other physicians that I was working with, because I would have something that didn't just meet my standards for quality, right? But it would also give me a competitive edge against my competitors, because I would have something that they didn't have in their standard tablets or capsules. I had something that was going to give my patients access to something new, novel, and improve their compliance, and ultimately patient outcomes improved when we started to use a customizable product that tasted good, that generated for them better patient outcomes, for me more patient referrals because of that. I mean, that's an incredible impact when it comes to medicine and patient care, right? So while that was huge for me, one thing that was enormously huge for me, because I get to work so closely with everyone in nutraMetrix and Market America, is the footprint that we are all leaving in this industry. When it comes down to it, and Dr. Stan Pierce said it, on your deathbed, you want to know that you created something and that you left something remarkable behind. So that's something that I believe nutraMetrix set out to do, and knocked it out of the park. We currently have some incredible educational opportunities available. We are utilizing Facebook and social media to support your healthcare practitioners on a daily basis, giving them access to live webinars, what I refer to as grand rounds, right? Giving them a community so much bigger than they previously had, because we've taken medical doctors, DOs, DCs, and other allied health professionals, and we've shown them or exposed them to one another in an educational forum where they're learning from each other. This is something that we get to do live several times a year through the nutraMetrix Educational Institute, and then our nutraMetrix sponsored product and implementation trainings. This is somewhere where physicians of all different disciplines come together and they start to educate each other about how to be better physicians, better medical detectives, and enhance or improve the blueprint, or the footprint rather, that they're leaving behind. Do you see how we, as a community, can reach far and do amazing things, right? When you look, I agree, awesome, right? But when you think about it, we have these two incredible trainings. The NEI training for that healthcare provider that is looking for evidence-based medicine. They're looking to see that this is the right choice, that the use of nutraceuticals is both safe and efficacious, right? They want the literature, the science, and the CMEs. You're going to go up to the concourse and you're going to learn more about that training and get your health professionals registered. And then our product and implementation training happens 2 times a year, coming up on the West Coast in Arizona, and then later in the year in September in Long Island. This is the training that we're going to really send the message home to your practitioners. Thank you so much for your time.